Feeling heaven's far from you. Feeling heaven is far away, never is far. Temptation storms sweet on you, forgetting God's controls of fire. When feeling heaven is far away, never is far. When feeling dejected, feeling lonely, fix your faith upon Jesus. Precious around you. Light will shine all over. You will see every night through me. Rolling inspiring hope in you. When all the big waves of the sea roll, must the saints do. The master saints to you. The down also shouts. The master saints to you. Release my way joy. The master saints to you. Take precious seed and in blood. Praise him down to serve you. And Jesus Christ the high Lord for my side. He is so God with you. Glory, glory before you on the way, King Cool. Jesus will come, King and we glory, sing and hallelujah. You will see every life in you. Glory, glory, inspiring walk in you. When you're the big waves on the sea of life, must the saints do. bien persil Wawujidon panon Yeyen kuma fufu tihu nama Yehu wedi Na yeni wu tifu Shasi yombi oswa Ya tu mi da jung di chi fin san jin yi ne Wa ye do mu mi da so mu se nya mu pe O ma sa pri yin ye sum de na tu yen ji di mu Wa ye do mu mi da so mu se nya mu pe O ma sa pri yin ye sum de na tu yen ji di mu
Be my song of praise, for there was grace that bought my liberty. I don't know why he came to love me so. He looked beyond my fault and saw my needs. I shall forever lift my eyes to Calvary to view the cross that Jesus died for me. How marvelous, oh grace that caught my falling soul. He looked beyond my fault and saw my need. If not for grace, my soul will be a drifting ship with no safe harbor from the angry waves. But Calvary's cross shine brightly through the darkest storm, and just in time, His mercy rescued me. I shall forever lift my eyes to Calvary to view the cross where Jesus died for me. How marvelous the grace that caught my falling soul. He looked beyond my fault and saw my need. I shall forever lift my eyes to Calvary to view the cross where Jesus died for me. How marvelous the grace that caught my falling soul, beyond my fault and saw my needs. He looked beyond my fault and saw my needs. He looked beyond my fault and saw my needs. Amen. Amazing. Amen. Amazing
Happy Sabbath. Happy Sabbath.
Happy day.
Okay. Yeah, the Nyankopon si senenso onam na dom so wahu ye mobo aboye ho ban. Na watchi nyina no na dom na ye kese wo ye so ye di free ye mfibe mu. Pacho motimenka. Ye di free ye mfibe mu nyina so. Wama ya ante boni bia enenso ye second day e wo ye retreat mu. Na yɛda nyame ase bebree sɛnye nipa nyinaa ne nya saa akwanya wei nanso bra mfram mabɔne yi nyinaa mu Awurade ahwɛ yɛ so ama yɛde nya akwanya yɛda so wɔ n'anim a na yɛ adom ne aseda mfamokyerɛw mama yɛ mɔ mpae yɛda wase nyame kronkron yɛda wase homeda wura ɛyɛ wadom ne wahumɔborɔ nti na wo ma yɛte aseɛ Obo ye ho ban de yakɔ ye fibe ne ye difri mu nyinaa ya ante atenkabɔne biara papa ye wanim a ye ba besom homedai mu ye srɛw sɛ fa unhyira no gu ye nso ma ye akoma bia wala yi so ye srɛw sɛ hu ye mmɔbɔ ye mra ye ho ase na ye nhyɛ wo nanase yesiesie homedai emu nhyira nyinaa ye yapɔmuden ho asɛm ye srɛw sɛ bra akoma bia ase na ye ntie na emfa de ɛbɛyɛ aba ye mfa mo ye ho Yemfa emboa yen ho ne yenka bi nso nkyere afoforo. Yeda wase Awurade sɛ watie ye homeda mu e wo wadom nti. Amen. Enne de Nyankopɔn nam nadom so ayeto yen safre no na wanyi ne nsa wampopo ne ti. Na wo ye na adwene sɛ obeboa ye na wo de yapɔmuden ye ma yapɔmuden ehun nkyerɛnkyerɛ anase yapɔmuden adesua ne bebrɛ ye no ya sɛ dɔ ye medamo ase
Amen.
Amen.
Maubia, happy Sabbath. Where they met that women's ministries in Pennyfoase for said the mama may chance that may a women's health lecture. Now, women's health, you know, a very, very broad. That topic is very broad. It includes many things because your body is very complicated and see. You can't women's health on topics but then we're not going to talk about all of women's health, but I should pick it some topics are very there is a reason why yes paps me and see my topic let's share my screen oh my a paps me somewhere to me I'm going to share my screen not my home paps me I mean a PowerPoint okay, very good. All right. And see, women's health, my title is cervical cancer, ovarian cancer, and fibroids. I think that
these terms, so you're about what is these type of terms: cervical cancer, ovarian cancer, and fibroids. And my hope is that by the end of my lecture, ubenya some new information, and as and maybe I say more than before. It is very important. So you need to know these things because BB I bet me see what life, and also with Yonko life cry you can they will experience that. And very important say conditions and I say area and I say. So moving on, women's health in general, so your drew ages 21 and up are very important. So when you're with your own primary care doctor or GYN, gynecologist, and found say why worry and found say why experiencing anything. So you're 21, so free pediatrics a form now about gynecology and I said primary care. Within that time, Ombema with different type of tests depending on your age, depending on different things. Ombea will test, and they're very important because so one year these type of tests are obetimianya ebia kauye test earlier ebia sayari happen, and so they're very important. Say if we are in your 20s, 21. Shada couple your own private doctor and I said gynecologist or even both. So both. No shada because what will happen is that only that doctor no be formal relationship. That doctor no be what is going on with your body. And he said in case of emergency nothing na ube explain long history. Doctor no knew already. And see how betting what is that yes anatomy. Anatomy of the female body are very special because this is what makes us different. Would you compare Bema or they're all on the screen right now? No, they don't have these things. This is what makes us special. And to me explain it, as I go through picture. First, we say ovary. Ovary, I think say in tree, Becca say Obano Cosiano. That's where it is located. So these are where the egg, this is the egg that allows cell betting. And then you're looking at this red tube. Red tube, your friend of fallopian tube. A egg, say what drew time egg be travel into this fallopian tube. Not a share bema no sperm. And the egg no sperm no share, and here that's what we call conception. That is the beginning of pregnancy. And then what will happen is that egg be travel na alande or uterus uterus and no your friend that is where a colano be for 9 months, and that's after 9 months na what will this area here cervix, your front cervix, a hot na a that is where they will travel to come out. But what is important about these things is that in each area, I know that might describe what ubetimania cancer. This area, cervix, ubetimania cervical cancer. In this area, the uterus, ubetimania uterine cancer, and I said endometrial cancer. And then finally, in this area, ubetimania, what we call ovarian cancer. And see, a very important say, what signs and symptoms correlates with these type of cancers, and very important. So let's talk a little bit about cervical cancer. Cervical cancer, by the end of this year, 2020, over 4,000 women died from cervical cancer. And see, a idea is very common, very important. And usually, diagnosed with usually they're in the age of 35 to 44. Also, group that normally this area Spanish for African Americans and but there's something that we should keep in mind, because African Americans and yet just you're just thinking, say, African American for or Moka or Mohonsem. No. Actually, cancer group, as Africans, immigrant Africans, they don't differentiate between African American and African immigrants. The said, so what's a chrome how we are American, we are African American. And so can't these statistics. So it's very important for you to know, because sometimes, culturally, sometimes it's me isolated. I want to say but we are part of it. And these difference, we also can get it, and so they're very important. And also something that's also important to note, and it said we will be our shada every year. Call doctor no doctor whatever tests or whatever exams that are here for age, all those things routinely. You are one of those people that who drew the age of 65 and above. We're not worried about cervical cancer for you, because why who test for many years and see if anything was going to come up, we have already seen it. And I say you bet me catching them. And see, that is why a routine physical exam is so important, because you want to be able to catch things early. And yet what dreams say, oh no, me come a doctor many bad news, me any bad news, or me bad news back to me. So no. You have to go. I said, anything is going on catching in time and correct it right away. And then finally, cervical cancer. Another thing that's really good about cervical cancer, and they say, 90% survival rate. Diagnosis of cervical cancer, 90% in the moon. And they are very good. But the only reason why, 90% when you're so high, and they say you will start test pap smear. In the beginning, not maybe about pap smear, and so we're gonna talk about that pap smear. So your body, you have seen this, and that's why go through this exam, pelvic exam. We call a doctor why I say pelvic exam, because pelvic exam bachelor doctor what is going on within you. Is there something going on? Ovaries, is there something happening? And your cervix, what is happening there? Now, pap smear, the type of test that you're to look for cervical cancer. Cervical cancer, and yet the other cancers, beginning with uterine cancer and ovarian cancer. I want everybody to know that pap smear, tested for cervical cancer, and see just this area here. I'll picture I hope somebody arrow that I'm pointing to, but this area here, that is what we're testing for. And only cervix, and then I know how this is the egg, and then sad tube. I was talking about fallopian tube. That's it right there. And what we do is say, they brush it. Now, sa brush baby cells, every sa area, and then we take it to the lab. Lab, test it. I won't say it be our lab cells normal, and I say and normal. Now, if be pre-cancer cells, sometimes maybe as a white koyasa as pap smear, maybe a cancer term natural, atypical cells, pre-cancer cells, and what it means. They say all cells are a potential to become cancerous, and yet cancer, but so one monitor those cells are a bit done in the cancer. And see, normally, this is the early stage. This is very early stage, and sometimes these cells and no clear, especially in the younger age group, to say 21, 25, or age group, 21 to 24. Usually, say pre-cancer cells, before cancer cells. Now, normally, we give them time. If I can say, oh, let's wait 1 year, and I what will happen. Over 1 year, and by test cancer, and that's a pre-cells, and see, very important. Another thing about cervical cancer, and they said one of the biggest cause of cervical cancer is HPV. I think say HPV. HPV, a virus. human papilloma virus. It's the coronavirus in the higher this year. No? HPV, so a different type of virus that and also and that virus, a sexually transmitted virus. It's maybe you thinking say HIV type of virus, and yet that type of virus is so common. Say many of us sitting in this Zoom meeting right now, maybe at OSA virus, because any symptom, sometimes it doesn't show any symptom, it doesn't show any sign, and they're very common. But once a virus, they don't tend to cancer. They don't cause cancer. Once a flu, you don't hear say flu virus cause cancer. You don't hear say HIV cause cancer. In coronavirus, we haven't heard say it's cause cancer. This is one virus, HPV. This is one virus that causes cancer, and it's a very special cancer, a different, virus, a different type of virus. Now, another thing about it, they say there are 150 different types of HPV, 150 types, and yeah, all those types in that cause cancer. But some of them can cause cancer and some of them don't cause cancer. The only way we say HPV and I said what type of HPV that you have is to do SAT test, pap smear. I know say I'm out for maybe some young ladies cry be almost say on that type of exam. They will say oh men worry that and I say me be I don't need to do that test. It has nothing to do with that. Because sometimes that HPV, even just basic touching in that or private area, that it can transmit that type of a virus. But that virus, that will be transmitted, and yet cancerous type, but still HPV can easily be spread. And so yeah, very important. Say, that type of as June 21, age of 21 going, and so yeah. And then how frequent should you do SAT pap smear? Normally, every 3 to 5 years, depending on what is going on. Maybe most of the time, say you tested cells, and we also test for HPV, to be BI normal, we'll say so they brought back 5 years. So why pap smear, routinely, we will say so they don't worry, come back in 5 years. You don't have to come back every 3 years or every year. Some facilities and I said some hospitals, every year. But I think the new test that are out, it requires only 3 years testing. So anyway, the point is a routine test that you have to do that test. Another thing about HPV, that are very special, and it's that a home vaccine. And that vaccine, a vaccine, we don't give it to you once you get HPV infection. Vaccine, you get the man in Colorado. And so at the age of 9 to 11, I'm sure that the doctor now offers that vaccine, your friend a Gardasil or HPV vaccine. Now, I didn't say that vaccine so early. The reason why I did that vaccine so early, and we can even give it to men as well. We give it to them at that early age of 9 to 11 because my body needs time to learn the virus. And my body needs time. So they'll bet me a virus, just in case our body exposed to SARS virus, me ability, and I said, me SARS virus, right then and there. And see, that is the reason why. And then it's a much better immune response. And I said, body, exactly what to do. So the SARS vaccine, and my at an early age, that will happen. So that is the thing with HPV. See, very important. See, maybe our doctor now offers that vaccine for Obano. Don't say no. This is one vaccine that I actually encourage. Maybe a flu vaccine, sometimes I am easy with that with my patients. But HPV, dear, I always say give it to your child because you do not know what will happen in the future. the Obano Bay, at least what protected Obano from what can happen in the future. So let's talk about signs and symptoms of cervical cancer. What symptom, and as a sign, Ben Nabeba will to tell you, say, Ebiawanya, this cervical cancer. And so, Ebia period, irregular. Normally, periods, a sign said you need to go to your doctor so we can check. Another thing, say, and then all of a sudden, then you're bleeding. That's also that is also a sign that something is wrong. It's not normal. The stage of menopause, ages, average ages 60 and above. What you start stage, for many years, unya period, but all of a sudden, 1 year period, that is a very, 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 very concerning sign. This sign in particular, I know you're very important because many women, almost ignore this sign. And I said, they thinking so of menopause, unya period for many years. All of a sudden, when I said 1 year period, and I saw papa one who said moja, toilet a sheet, so paper. You have to go to your doctor and check because that is a very concerning sign. That is not normal. So what you menopause, that's it. You should not be getting any type of bleeding at all. Another sign that's also very important is toilet now who said there's blood in there. That can be something else, but don't ignore it. Call doctor no physical exam no or area to make sure that this is not something that is concerning. So cervical cancer. Talk about uterine cancer. I say uterus, this is it right here. Ultiminia cancer in that area. Now, what is so remarkable about this type of cancer is that over 65,000 new cases just in this 2020, year of 2020, there will be over 65 new cases of uterine cancer. And uterine cancer, I know you're very aggressive, very, very aggressive. And most importantly, the largest group of people that get it is white women. But say it is very aggressive and yetini won't intend. So it is important that any sign, and we'll talk about those signs, but it's very important that we'll better check it one. Now, one of the risk factors that are really interesting is weight to the that is a major risk factor for uterine cancer. Another name for uterine cancer is endometrial cancer. And so what those terms are, that's what I'm talking about. So weight you have to pay attention. So we'll lose weight because that puts you at risk for uterine cancer. And again, menopause age 60 and above, the older you are getting, the more likely that will be developing type of cancers, especially uterine cancer. Survival rate for uterine cancer is 81%, which is very good. But that is if you catch it, you're in time. If we don't catch it in time, your survival rate is much less. Other risk factors that are very important, unya period very early, at the age of 8 or 9. Period early, they have a risk of uterine cancer. What for many years, unfortunately, that experience and that opportunity that puts you at risk for uterine cancer. It is very important for us to know these things because the only risk you go to your doctor and you make sure those type of examinations that these conditions. So let's talk about signs and symptoms because that's really important. Again, it's almost the same. Cancer, in this area of your body, their symptoms, they are very similar. For example, a scent biaba. And I say, so I free woman, ebia science, scent home. And I said, color no yet different. These are signs that you need to go to your doctor and check. Ebia wanya abdominal and I said pelvic pain or yam all the time. Ebia ya, but I said pressure be, I said BB eshel. That is a sign that something is going on, especially for menopause stage. Don't ignore these things. They are very important. Go to your doctor and check. These are signs that something is wrong. Blood and urine, and sometimes it can be just a urine infection. It be a big deal, but you don't know. And see my exam test that a bit me what is going on exactly. And then it be a very uncomfortable, a very, very painful. These are signs that be something is going on. So these are signs and symptoms. Also, another sign and symptom that very important to note is constipation. I don't know, constipation. Maybe I said, toilet. Like every time you try to go to bathroom, I say it's so difficult for you. And sometimes that can be a sign. I remember, so one of my patients, she came to me and she was saying that she's having difficult time going to the bathroom. Or call bathroom, I just said, and afterwards, no cry, no not so what I did initially, and they said I gave her a drink, it be a Miralax. It's too soft. And I say, go drink that drink, maybe a beboil, not what's in your toilet. The following day, now I said, no, doc, this is really painful. I'm really uncomfortable. And I say, no. And yet, normal, especially for this lady to keep coming to the hospital like that. And say, Juana, we sending her for a CAT scan of the abdomen. Yes, CAT scan, unfortunately, not what cancer not drew stage 3 already. Now I spread it already. And see, very, very important. Any little sign. Through all of that, later, and I'll say, you know what, doc? For almost 1 month, I was suffering with this constipation, and I also was seeing blood in my urine. I didn't think it would be anything. And see, already, some signs it is. Even if you think, say, I did Kitswebe, it doesn't matter. Let your doctor know, because it can be something serious, especially if you are at the age of menopause. It is really important. Any body change, you want to let your doctor know. Uterine cancer treatments. And see, treatments, we will do chemotherapy or radiation, or unfortunately, it be a surgery, i.e., would all your female parts now, you have children and that kind of thing. This can be very devastating. 13,000 or close to 14,000 from this ovarian cancer. Again, very common, and also common in white women, but it is very aggressive and it spread it quickly. And see, it's very important for us to again check ourselves, go to our doctor. Symptoms, yet the same. Abdominal pain. Another symptom that's very common is weight loss, or weight, article. You don't understand why, but you are losing weight, and these are abnormal signs. We am not say I can say for no reason. I say I want to be signs that something is doctor, and get that exam, and then treatments. The same, surgery or chemotherapy. So finally, vitamin D deficiency. You want to take vitamin D because studies have shown that vitamin D and protecting from protecting from virus, but so virus now, and yet complicated and cause any serious problems. Another for vitamin, need those type of things too much. This is your risk factor. You can develop fibroids, but also you can develop colon cancer, and that's a different type of cancer. But that's also another. You don't eat enough green vegetables. And your vegetable be green. It has to be green. So your broccoli, your kale, these leafy greens, a boapa. Faka will diet, because it's really important. Spinach, udia not only preventing heart attack and diabetes, it's preventing cancer as well. So it's really, really important. So you'll be able to know alcohol, luckily, as Seventh-day Adventists, alcohol, it shouldn't be our problem. But unfortunately, if you are one of those people that be careful, because that puts you at puts you at increased risk for certain type of cancers. Family history, had fibroids. That is a risk factor for you, and likely also fibroids. So these are risk factors for fibroids. Now, you're bleeding so much to the point that within 1 hour, fill or menstrual pad. In just 1 hour, you can fill it 2 or 3 times. Not normal. Within 1 hour, you shouldn't be able to fill your menstrual pad that much. And see if that is what's going on, go and check with your doctor and make sure nothing is going on. But if you all experience these type of symptoms, it could be you have fibroid. Anemia causes weakness or any type of activity not what brain. That is a sign of anemia that can be due to you having a fibroid. Abdominal pain, pelvic pain, period too much is to another extent, it can be due to fibroids. Fertility changes, and I think that this is the most concerning part for fibroids, because I worry for many years what try but unfortunately it's not happening. Sometimes it can be due to a fibroid, because that tissue block. If you will remember picture that made the trail, that egg travel share a sperm. That area, sometimes the fibroid can be blocking that area, and that is what's preventing you from getting pregnant. Constipation, constipation, and even so, you're lucky enough, maybe fibroids, but you were able to get pregnant. And also, cause problems for acrolano, because as acrolano, not fibroid, I compress it acrolano. It can kill acrolano, because as acrolano now hormones feed fibroids, instead of feeding is feeding the fibroids. So it's really important to pay attention to those things. So that brings me to the end of lecture of GYN cancers, and I said women's health, cervical cancer, ovarian cancer, and fibroids. And see, I think that we have actually a lot of time, and see, may use the next 30 minutes for question and answer. And I said, Zoom, so a registered nurse practitioner, doctor, you will bet me answer some of these questions, or bet me a contribution as well. And see, it might be a flow for any question and answers. Yeah, so any questions, and that means that I did my job. And see, I don't know, a coordinator, so bet me I intervene at this point.
Dr. Mpacho, me question kakra. Mpacho, about fibroid no, na mpesa mbusa baby kakra. Me wo ye 15 months ni. But me wo ye ne me nya me menses da. So say me baninya 1 year and 1 month. But me started say me nya me menses no. Me nya heavy flow pa. Could it be say betimi aye fibroid and na say menses na basa.
Yeah. Actually, that is a very common some women experience. Sometimes a bit to me a fibroid. Keep in mind it's a fibroid, and anything say fibroid, it doesn't mean say dangerous AED, especially if it's not causing any pain or any symptom, any big deal. But sometimes a bit to me cause heavy bleeding. The heavy bleeding, it becomes a problem when you are having symptoms to say, why not so what breath? And I said, like you're breathing, now you're short of breath. You're having a hard time breathing. And I said, need to breathe. That means you're losing too much blood. And see, that is when we intervene. We will give you some type of medication. And as I said, GYN, decide to say, be a fibroid and free her. With that, on betting me about medications, and yes, said betting me about medications, and the fibroids, betting me shrinking. And see, it can be a normal, that's just your body after pregnancy, it be a normal reaction after pregnancy, or it can be said, a fibroid. The only way to find out is what? To do a physical exam and see your doctor. I hope that my answer question, Mama.
Me pa try. Ne me check up na na mashe.
Yes. Very important. So it'll be a different question. This question.
Host maybe. It's all question be a bisa. No year no answer no. Yes, someone.
Hello.
Hello.
Doctor. If I show.
Yes. Waba mama ni mejira.
Please.
Financial from
Pacho, me question kakra.
Pacho, bisa a question.
Yeah, me question about
man interaction.
Hello.
Hello. That's a very good question. I know there were different reasons one of them being maybe take family planning to sell maybe only family planning. Sometimes there can be some hormonal changes. Maybe a thyroid, your organ, and what happens is that it secretes period. Serious. Another concern is that it be so tested for pregnancy because they be onion that can happen, and especially for younger women, especially down, they don't know. Maybe they think so. I don't have my period, but meanwhile, so they are pregnant. I've seen that many times, and so very important. So we'll contest it, and so sometimes it can be usual. There's so many things that influence your hormones that can cause that type of thing. And then sometimes it can be because of cancer. There's something going on. And so very important. There's no way that Metimiafra will just face value. I mean, what is going on? Some exams, ultrasound, different things to determine what is going on.
If I show one more question, and can that something like that lead this so be to me more now? Want to me more, yes.
That kind of thing where you don't get your periods. It makes it very difficult for you to get pregnant. And so, yeah, and also no, it can be said there's some hormonal change that is causing.
Pacho, there's a question on the screen.
Yeah, my question.
Yeah, but me answer mine. But me address this question.
Okay. First question, and it said, what brings early menopause?
Yeah.
And what can be done to help? Sometimes early menopause is not anything that we can control. It be genetically, body, our program is at a certain age that can happen. Some women think, say, be automatic family planning or birth control, no, it be automatic menopause, not balancing. Sometimes it's really not that. Sometimes it's just genetically, that's what's happening. So that is the answer to that question. And then the other question is it only cancer that can cause your female organ to be removed? Yes, or there can be maybe a fibroid. Maybe a fibroid is not cause too much problems. All these other things. Fibroid will cause problems. In certain scenarios,
you have to put the phone so Patricia could
female.
Hey.
So, question.
Hello.
Patricia, question.
Yeah, me that's it. Me person me who say fibroid na o ka se bia obi wo family mu se bia uni aba o obi a nso betimi ni se bia wo
Pajo, as a kasa no kollo, she said.
Hello, Pajo, betimi. Se bia wo hu se uni obi a what can
you do to prevent a fibroid? Pajo Timenkan.
And they say exactly the same question I'm trying. What can you do? So family anymore.
What can you do? Evaluating yourself and finding out that if that is also a problem for you. Sometimes, like I said, sometimes fibroid, if you are a fibroid, but really because you don't have any problem. And so sometimes fibroid is not a big deal, but it's more of a risk if your mama and I said your sister or somebody in your family have it. It's likely say be also betting and that type of condition. But there's really nothing we can do about that.
If I tell me man, see me my host ni ebio bia see the beya e betumi akasa ba kasa na nkoma na ekwechi ekosho echi it's just not right into he's going to mute everybody. What question am on so and answer for two screen.
Natural bizarre question.
Okasa emono okasa.
Yeah, they were a man and mem. Very true. The reason why they were a man and another period. 3 or 4 days, no overtaking education. 3 or 4 days prior to your period, overtaking 600 milligrams of ibuprofen 3 times a day, before your period will come and slow down. The next question is, what causes parathyroid hormone? A body, it's a part of the thyroid, and parathyroids, they have their own function in our bodily, but there's nothing that will naturally, you can do to prevent if there's an imbalance. What commonly happens is that your baby parathyroid and everything. But I don't want to go into that too much because that has nothing to do with the female cancers. Maybe another time, discussing that. You can call me separately and we'll talk about that. Here's another question. It says, I was told that eating red meat can cause the fibroid to grow fast. I know someone who was put on vegetarian diet for some years and was able to give birth after. What do you think about that? That's exactly what I was trying to discuss. One of the risk factors of fibroids, and it's that all red and greasy foods, unhealthy foods. It really, really, really plays a role in fibroid growth because those things, increase hormones or hormone imbalance about our body, and that hormone imbalance causes the fibroid to grow. And so I agree, sir. If you are having fibroid problems and also start with diet, it really does. We'll give you some other type of hormonal treatments To avoid those unnecessary hormones and different medications and their side effects, try to change your lifestyle, exercise routinely, eat healthy. These are things that with time, over time, Ubehu said, symptoms that you are experiencing with fibroids, Ubehu said gradually, cut down. So it's really important to do that. Another question is, can early menopause put you in danger or make you sick? No, early menopause will not put you in any type of danger. It's unfortunate that it's not a problem. But I should say there are some I know possible. We are so heater our body no more. That is what hot flash is. Symptoms that can come with that vaginal dryness. Vaginal dryness can cause frequent time you have urine infection, and the hormones are not there anymore, and so you're getting those symptoms. So I wouldn't say it puts you in danger, but so when you're lucky, you experience some really uncomfortable symptoms that you don't like. Okay, another question is, if you had a total hysterectomy, can you have any of these types of reasons we do that surgery? Because we know that if we remove it, there will be no growth. There's nothing for the cancer to grow. So yes, it is very that is something that we do so that you don't develop that you don't get hot flashes. Yeah, you are one of the lucky ones. So if you don't get any hot flash, it means that you just don't get it. But sometimes I've had women that they didn't get anything over 10-15 years, and then all of a sudden they are developing those symptoms. That can happen. One of the things, let's talk about hot flash a little bit. Try hot flash they're very uncomfortable for you. So these are things that will bet to help yourself. Why? If you've and why would this happen if you've always had a regular menstruation? Because that can be a sign that something is going on. Most often for someone that bleedy sano, the first thing that I think of is fibroids. Is there a fibroid going on? Depending on the age. So we are younger, I'm thinking fibroids. When you need over 60, I'm also thinking cancer, because again, our age group, 60 and over, they tend to develop the uterine cancer, ovarian cancer. Another question is, how can one prevent getting regular urine or bladder infections? So there are certain things that you can do to prevent urine infections. Number one, don't wait and hold. Some people don't like to, they don't like to use public bathroom. And for many hours, that can actually increase your chance of getting a bladder infection. And it's very important. So I know you will have it. Don't continue doing that, because eventually, that can cause a urinary tract infection. In the bathroom, because it helps prevent infection, like a urinary tract, that you can do to prevent urinary tract infection. The next question is, what advice can you give to someone who has gas constantly? So gas can be from your diet, and that can give you gas. So evaluate your diet. There are certain foods that more gas, cabbage, broccoli. There's foods like that, even dairy, milk, cheese. Sometimes it's a sign of some type of some food insensitivity for you. So try diet, and see what you are eating that could be causing excessive gas. But on the other side, if you are an older woman and you come to me and you tell me, sir, all the time, I said, well, gas, I said, pressure be about or abdominal area, or want to remove that diagnosis from my list, because sometimes that small symptom, that gas, what is gas? It shouldn't be something serious, but it can be a sign of something very serious. And see, depending on your age, I will really look further into that symptom. Oh, there's another question.
Doctor, min kasa kakra ansa wa trust me nuan your time na assume to say last question and that's no. Oh yeah no we are near the na yada na se na afi we jai hoko.
Okay. All right, may read a question, a final question. I have been breastfeeding for more than a year, and my periods are irregular, like having your period every 2 to 3 months. Am I at risk for cancer? That's also a very good question. No, you're not at risk for cancer because you are breastfeeding. Because of breastfeeding, some hormones my body knows some hormones to stop having periods. And so even a year now that you have been breastfeeding, and now those hormones from the breastfeeding, cut down, and that is allowing for your periods to breastfeed, and you're still having these irregular periods, I would definitely go see your doctor and make sure that nothing else is going on. Do you have a number? Okay, and see, you don't want to put your question on this Zoom platform, and that's so fair. So let me start with question. My number is 24 hours a day, 7 days a week. I'm available to answer any question, or if there's actual and help in that process. That number, I know your 1-800 number. I hope I will give you the right number, but 1-888 524-73 for question. But me, I use that number. No, but me, I press that number. And that will be another way to reach me.
Yo, in your name, na come na yenda in yaba any Dr. Priscilla Ase. Just last Sabbath when the meeting didn't come on no J penny, Nanya Miadum, or Babedumi, Akasa train. The rabbi Yami win show, not for moaning dear baby, net twasso, Nafi, a brody would year with man was Sunday a boy for François in here or more. Inti, a dorsey baby, Nanya me so a name. Time I was spent with us. Nafi catch our Brenton Ocean say we love him so much. But next time I man in so. Only about Vivian Boy, my suburban pair, my Nafi, the Jumadin Abbey, a chanya boy. It's not say a first Sabbath into no prayer and fasting. To what bet me do you front tone for your front tour. Nafi and Sankuya meaning our pie boom, Nafi. 5 to 6 in the program. Let's share the morning devotion 5 a.m. Yamra so 4:30. Now if you fan prepare your home food you into unia ba Vivian Boa my so bompa enough if a point. Now before then me say Dr. Kofi Appiah so aba so pay ye da si bebre nyame insure say wa ba be kan ho. Unia ba mpa point.
Yo pa cho me mon pae. Yeda wasi inyameni abanke sie homedewura nyumrei kuna mafuna so akyerɛkyerɛ nneɛma bebree yeda wasi papa nyansa ne nimdia odi adom no kɔsoa ne bue n'adwene mu kɔsoa ne mane nyansa kɔsoa ne mane nimdie ada bia de to nsafrɛ na wadom nti odi ba bɛboa wasafo yeda wasi enyumrei ɛma adwumadi esronko a odi ama yɛngya yɛsrɛw sɛ wadom ti kan yɛn ho wa yɛn na na dwufa yɛkɔden so Ochanapa, Wanyania, and what in for from the Fedumadiana, Dumum, Mr. Quavia, Edia Seda, Amaudi, Shawafna, Nebusiana, Jia Washri, or Wasafo Hunti. And you may other was sick, Papa, was one Shawama, was one a Kayaho, Yejumadiamo, as an Inina Quavia, programs in Inina, a Casa for Shire Homedemo, or Yes Christo Demo, and Yabon Pai, Wadumunti. Amen.
Amen.